Hello everyone. Let's today's discuss on the topic of the patient journey as a business analyst in perspective. Okay, in the perspective of business analyst. So there is, if you saw the job description of business analyst in the hospitality industry or the hospital industry, so you find that to patient journey, how the patient will come in the platform in the hospital, then how to interact with the admin team, what detail they will take, then the appointment with the doctors, to specify according to the disease or the illness of the patient. They assign the doctor, then they give the treatment on online, and then they will have some operations related thing, admit related thing if they admitted, then the discharge related thing, and the follow up of this thing. So that all these things are included in the patient journey. So let me explain you step by step in detail and understandable manners. So you should be able to give the answer of the you explain. If interviewer asks you, explain me the patient journey, or explain me the key components of patient journey, explain me the key factors of patient journey. So that kind of answer you will be able to give the very well, and the explainable to the development to the interviewer, and how it should be be the part of system, how the IT system will interact it in this case. So let's start with, guys. So first one is a introduction. What is the patient journey? So you should know what is a patient journey. So the complete experience a patient has with the healthcare system. Yes, it is the patient journey is a complete, and how he will interact with the the hospital system, and from the first symptom or health concern or the post treatment follow on ongoing illness. So the basically the patient journey is the the I already explained you the how the patient will come in the hospital. So it may be refer from the previous doctor, or it may be directly come to the hospital. It may and then register, then appointment with doctor, get the treatment and get the solution, and recover the body and he feel well, and then the discharge, and then post follow up, and then finally if the patient is okay, then close that case. So that's the entire journey, and that's the patient journey. So the scope encompasses interactive with provider, administrative staff, technology and information. So there are the different departments, in the hospital industry. So like administrative staff, technology, in doctors, or the nurses, or the bed charge. So that's the different department how the patient will interact it. So that should be covered in the patient journey. So first of all, you should understand the entire hospital objective. What are the services that hospital will provide it to the patients? Who are the doctors there to provide that services? Their qualification, their experience, all these things should included. So the patient will get the treatment from the doctor, so they should know. And then there is the entire thing will added in that platform. So that's the in-scope functionality. So that should be there in the patient journey. So let's the why it's matter. It's a very important factor because of it satisfy the patients. It should be a process. It should be a systematic process. So operational efficiency, it increase the operational efficiency. It track the ease the patient, each and every patient, and the business outcome. It enhance the business outcome. There is a systematic way to do the the patient will came, then do the treatment and go out. So that also the detail way. So there is a finance involvement. So to collection of the all the charges that the hospital will take from the patient. So that should be it's the systematic way, and the appropriate way, and the data should be anytime they can fetch. Then let's discuss on the role of business analyst in healthcare. It's an most important if you are currently working in the healthcare domain, or if you want to switch from other domain to the healthcare domain. So it's a very huge and large domain. So it has large opportunities Okay, you can learn many things from this domain. So let's discuss the that thing in. So first one is the core function of business analyst in the healthcare domain. It's the common. So the business analyst will find the gap in the current process or the current system and gather the requirement from the stakeholder or the subject matter expert or the business team, and then prepare the documents, FSD, BRD, approach note. Okay, and that will be the make the same page for the business and business team and the development team or the technology solution team. So that's the core function of business analyst in healthcare domain. So then the key responsibilities of business analyst, like the requirement initiation and requirement management, then the process analysis optimization, stakeholder communication, the solution design, implementation support, data analysis. So key responsibilities should let me give you. So understand the business objective of the hospital industry, how the hospital should work, how the healthcare domain is work, on which product project or the product the business analyst should work. So understand their the key users or the key operation persons, what are their operations, what are their tasks. So then the and at what stage that project is, that is that should be most important. Then accordingly gather the requirement from the client using the requirement initiation technique like the questionnaire, interview, chat session, brainstorming session, group discussion, meeting, team meetings, okay, one-on-one discussion. Then to manage that requirement, then the process analysis and optimization, then prepare the wireframes, prototypes, change request document, FSD, BRD. Okay, as per the request from the business team. Once that is get done, then collect the update if there is a request enhancement in the change request in the current request. So update the version of that document, and then the explain that features or function to the development team with the gap analysis technique, what how the system is currently working and how the system to be working. So each component in that system should explain what are the features or function are get impacted from that changes, where we are going to check the changes and what we are going to make on that changes. So that thing done by the the business analyst, and continuously communicated with the business team and the development team and the solution and design. Once the data analysis and reporting and the unique so that thing is there, and do the UAT testing, production deployment support. So all things are there, review the SST document. So that's the thing is there. Then the unique positions to identify the inefficiency, opportunity for improvement, and the patient pain points. What are the challenges faced by the patient from that system? What are the opportunities that we will implement, improve the system, and get the better experience of all kinds of users or the patients, and the what are the inefficiencies, what are the things are not there in the system, if that things have in the system, so system will perfect and that satisfy more, that provide the more good experience to the patients or the operation team. So that should be analytical thinking should have the business analyst. Okay, let's move on the next topic. Why is understanding the patient journey crucial for business analysis? Yeah, why you should understand, why it is important to understand the patient journey in the one of the the hospital. So holistic view, move beyond the solid department process to see the entire patient experience. Yeah. So business, so because of there is how the patient will come in the hospital, and what is there the process, how the system will interact with the process, how the treatment will take, and then how the patient will get discharged, and his the post discharge clarification. So that should be there, and patient should have the better experience from that hospital or get satisfied from their the treatment. So that should. Then the problem identification, pinpoints critical pain points, okay, bottlenecks, and area of dissatisfaction of patients and staff. Yeah, you should be understand what are the problems in current process, where at which the the stage most of the patient is get dissatisfied, what are the challenges faced by the operation team. what are the problem in the current process and identify how we will improve that process, what are the techniques or the tools we should use to better experience. So that's the key roles of business analyst, to identify the problems, the requirement accuracy. So always the business analyst should make sure that the business requirement is perfect, or it should be satisfy the definition of invest smart. So it should be a testable, independent, it should be the usable. Okay, so there should be a high requirement accuracy, ensure the solution truly address the patient need and improve the outcomes. It should be a positive response from that requirement. Okay, then the process optimization. So identify the opportunities for streamline workflow, reducing the waste and inefficiency, enhancing the efficiencies. So that should be a the process of, there is the different a number of way we should do the process. So the business analyst should think how we reduce the unnecessary tasks, how we reduce the not required steps or the steps that should in their current process, enhance or add some unique features, unique steps that should be get give the better experience to the patient. So that should be the process optimization. Then innovation uncovers new services, delivery models, and digital solution, patient engagement and strategies. It improve the continuous updation on the message or the mail to the patient. The new enhancement, use the AI ML technique or the new techniques to to get the innovation in the patient journey. It make the way more optical and the updated status wise. So your appointment is on, so the patient will get the appointment details and all these things is there, and make that way to think to increase the patient's accuracy, patient's innovation experience. So risk mitigation helps the anticipate and address the potential issue before the impact patient care on business operation. So it will the mitigate the risks in the patient journey. It will mitigate the risks in the financial budget, technology, and improve the patient journey in that crucial part. So let's move on the next slide. Let's discuss on the key phases of patient journey. You should need to be explain that phases to the interviewer. So let's discuss one by one phases. So awareness and prevention. So that first one is initial health concern, seeking the information and preventative care. So it focus on information accessibility, digital health tools, marketing channel. So to make the awareness and prevention to the public, so that allow to that the marketing, do the marketing of the product or their instruments or the doctors, all these things. So the patient will know how that hospital will be better to get better so treatment. So in the assess and entry, scheduling the appointment, registration, initial consultant. So that should be there. It should actually start the patient journey. So there is a scheduling appointment with the doctors and their proficiency, their charges that should be there. Then the registration. So patient will come on that page, register with their ID or their name or their government ID and their the disease, and then system will display the doctors, their experience, their fee charges. So then once book the appointment when the doctor will available, so that all things will display the patient, and then accordingly patient will select and then make the payment. Once the payment is get completed, then the doctor will assign their as per the selected time by the patient. Then initial consultant, then take the consultant from the doctor. Then appointment system, how should work, patient portal, how should work, intact patient, and the wait times. So that should be the system is there, and that system is focused by the business analyst, like appointment system, patient portal, intake process, how much we take the intake, and waiting times, how much time the patient will work. It should be a the physical meeting or it should be a virtual meeting. So that should entire their mention. then the diagnosis and treatment planning, then do the medical testing, specialist refer, diagnosis, treatment and option discussion. So that thing is there. The actual patient treatment, medical should be there. So all these things cover. If the policy is there, then the policy details should available there. Then the diagnostic workflow, how the diagnostic workflow will done if the patient is come, then register in the diagnostic system, then the diagnosis treatment, what kind of treatment they give, who the doctor will give, who are the other working member with them, which machine is used for that, and the patient betterment, then the referral management system. So if there is any reference from that no, if the good the treatment will get that, so he may refer some the other patients for that. Then share the decision making tool and MRE integration, how it will integrate, their result should attach. So that should be entire thing in the patient journey part. Let's Also, the phase four is a treatment and care delivery. So, receive the care, surgery, medical theory, therapy, ongoing monitoring to interact the monitor things all the patient. So the surgery will have with the required then surgery, medications and therapy should be there. And in that the treatment and care, the business analyst should know the clinical workflow, medication management, care coordination, patient education, how to educate the patient. There is the attached videos in the patient education according to their disease, how they will get the treatment. If they use some exercise, if they you eat some healthy food, so they will get high easily recover from that. What they do not do, what they do. So that's it's all things included in the video format or the documented format or the PPT file. Then the care coordination, how the care coordination will work in that system. Medication management, how the medication will done, how they are interacting with that system, and the clinic workflow, how the clinical will do. So that entire thing will cover in that part. And then the recovery follow. So post treatment care, if the patient is get recover and get the discharge, so what is the stage the hospital will follow to get the communication with the patients, and then give them the solution to make to check their the progress, it is cover the body or not cover, what the medical we need to give to the patient. So rehabilitation, then the follow-up doctor appointments to check all these things, and the discharge, all these things cover in the recovery and follow-up. Then in that there should be a discharge planning when they give the discharge, and is that patient is cover all these things or okay, and then take a reference from the discharge. So that should be there. Then the remote monitoring to monitor the patient's conditions with remotely. Then the patient support program, there is a program in that the patient will explain all the things, what they need to do, what they do not need to do. So that there is a experience. If required, they assign the experienced consultant to the patient, so they will consult, what exercise they need to do, and the billings, how much the charge will hospital take, and there is the entire billing process for there to the manage in that the recovery and the follow-up section. Then the ongoing management and the illness. So let's long-term care, there is the disease like the dialysis or the cancer, so that should be long-term care. It should be when the duration is large, so that should be there. Then the lifestyle management, how the lifestyle of the that all things is covered in the prevention and measure. So how to make the sure that patient will get well. Chronic disease management program, health coaching platform, and community resource. So that should be there once the patient is get recover from the disease. So let's move on the next topic. So BA activities in at each phase. It's important. What are the that's the phases I explain you. So what are the activities? So business analyst should have the data collection and analysis. So first, the business analyst should collect the data from the interview take from the patients and the providers, stop, So what challenges they face, where they get dissatisfied, where they get satisfied, what are their experience, what they have make the better. So that from that their primary data or secondary data they collect, and then the survey, focus group, observation, go to the site of the competitor or the other hospital, check their the screen and all things, so they can collect the data, then analyzing the existing system data, EMR billing, scheduling, how the currently system is work, what are the challenges in current system, make them notes, and the process managing and modeling. So as is and to be process follow seamless diagram, value stream mapping. So the UI UX should update it to draw the UI UX diagrams, waterfall prototype with using the InVision, Figma, Balsamic tool, mobile version or the web-based version. Then the requirement initiation. So from functional requirement, from the business requirement, create the functional requirement, non-functional requirement for the new system or the improvement. Write down the user stories, use cases, draw the UML diagram, draw the ERD diagram. Okay. So draw the wireframes and prototype to update the end user. How should it look like? Then the stakeholder analysis to in stakeholder analysis should do the resume matrix, so responsible, accountable, consultant, inform the stakeholders, do their analysis for the requirement gathering, identify all individual and group impact by the journey, understand the importance in that journey. Then solution design and evaluation, contributing to the design of new system features and process. So how to define the solutions for the system, to give the solutions, how the system how the patient journey will look like, how the operation journey will look like, how the billing system should work, how the videos will uploaded, and how that videos will make sure to what are the description below that videos. So according to the patient disease, so that should be there. Return on investment analysis should be there. Then the change management support, if there is the current process we are going to enhancing, or the upgrades, new technologies, or the product enhancement support. So accordingly we should make the changes in the current system, so assigning with communication and treating for new processes and the system. So current system how should work, how manual process in the current system, how we automatic to add the automatic process. So that should be done by the business analyst and entirely manage the change request for this. Let's discuss on the metrics and key performance indicator for the business analyst. First one, what we check that the system or the solution is correct. So patient satisfaction, NPS, SCAPS score. So that's the patient satisfaction score. How the patient will satisfy with the system. If the patient is satisfied, then take the questionnaire from that patient, and where what things make them more satisfaction. What if the patient is dissatisfied, then again take the questionnaire and improve the current process. The wait time, appointment scheduling and cleaning wait time. So that should be the key. How much the wait time should have. So that should be no longer, and immediate the patient will get appointment with the doctor with the time scheduling. Okay, the patient retention and loyalty. So how much the patient will once the patient is get created in the system, so how much that patient is come in to get the treatment from the hospital, is how much that patient is loyal, how much he should have the better experience with the hospital. Because the patient retention is also the one of the important key KPIs. Then operational efficiency, appoint no show rates, and the administrative burden, how the operation will effectively or optimum way we should work. So that should be there. And the cost care delivery, so there should be the system that the cost care redeem readmissions rates. That's the patient retention. If once the patient is get admitted and he is get successfully the treatment, then again he will come, and then again he will get the treatment. So how much the rates of readmission. So there is it should be it should be formulas look like, or to calculate the readmission rate. So the the patients which have the admitted in the system two or more than two times, and the total number of patients who should admit it in the system. So that will give the readmission rates. Then the treatment adherence, the digital adoption rates. So portal uses the telehealth uptake. So how the patient will log in their portal and check the treatment. So how the patient will digitally adopt it, and the stop satisfaction and improve the productivity. So how we will give the input and how much the output. So that is also there. And then the conclusion and the future health care, the future of the healthcare and the BA. So the patient journey is a dynamic and consulting involving. So it should be appropriate way. So there is the many job description you find the patient journey as a keyword, and if you want to be a part of healthcare journey, so you should mention on your CV to I am the proficient and understand the patient journey. So that will increase your chance. Then the BA are critical in driving the patient-centric innovation and operational excellence. Then focus on MT and data-driven insights and continuous improvement. Then call to auction embrace the patient journey and perspective to deliver truly transformative healthcare solutions. So that should be the patient journey should business analysts understand. So thank you guys to attending these videos. If you have any doubts or the open points, please let me know. I'll help you in detail on that. So thanks for attending my lecture. If you are interested, so please like and subscribe my channel. I'll be help you for entire thing. Thanks.